Diabetes doesn't just affect your blood sugar. It can slowly damage your nerves and blood vessels too. And when that damage reaches your feet, things get really dangerous. In today's video, we are going to talk about one of the most serious complications of diabetes, the diabetic foot. How it starts, what happens inside your body, and why a small wound can turn into something life-threatening. Let's dive in before it's too late to take the first step quite literally. Now, what is diabetic foot? Diabetic foot refers to a range of foot problems caused by long-term diabetes, ulcers, infections, nerve damage, and even gangrene. What is gangrene? Gangrene is the necrosis of the tissues. It occurs when the high blood sugar damages the nerve and the blood vessels in the feet. Actually, when the blood sugar level rises, it reaches the feet and it destroys the tissues in the feet. What happens in the results? Results is that there will be poor sensation plus poor healing, and that is a dangerous combination. That is a very dangerous combination. As we can see in this picture, we can see below the feet there are some ulcers, and this is a dry cracked skin. And as we can see that there is a reduced blood flow and the nerves have been damaged of the feet, and there is an ingrown in the toenail. So this is a picture of a diabetic foot, which is like starting to become a diabetic foot. Going on into the next slide, we will see that why the foot is most affected. Now you can tell me that why is only we called as the diabetic foot? Why not diabetic leg? Or why not diabetic hand? Or why not diabetic eyes or something else? Why only diabetic foot? Now the reason is that feet are the farthest from the heart. So the blood flow over there is the weakest. Going on into the next point, we know that nerves that go to the feet are the longest. So they are the first to be damaged by the high sugar. As the sugar level increases, the damage in the feet becomes higher because the nerves to the feet from the brain is the largest ones. Feet experience constant pressure and friction, unlike hands or ears. So feet always experiences the constant pressure and friction of the whole body. They are often enclosed in warm, moist shoes, perfect for infection. Always we are wearing shoes, and even many people wear socks. So that is the most dangerous reason for why the feet is affected the most. That's why diabetic complications show up first in the feet. Now here we can see a picture, an image of a feet, which is showing the symptoms of a diabetic foot. We can see that the color of the skin has been paled out, and the skin has no hair in it. Like there are no hair. The skin is completely smooth, and this is where the diabetic feet symptoms appear. Then, how high blood sugar damages the foot? Now, we will understand what happens when the blood sugar level gets higher and how it damages the foot. Blood vessels damaged. It narrows down the arteries and there is less oxygen supply. Nerve damage meaning is neuropathy, loss of sensations, that is, injuries unnoticed. When there is loss of sensations, that time what happens is that we don't know that somewhere we have been injured. Somewhere, suppose for example leg or hand, anywhere if we are injured, we cannot understand the injury. Why? Because there the nerve has been damaged. So that is called as the neuropathy. And blood vessel damage is the narrowness of the arteries, and as the arteries narrows down, there is less oxygen supply. Then comes the weak immunity. What happens is that if the immunity is less, then the infection will spread faster. Then there comes the delayed healing. Wounds will take longer to close down, or wounds will take longer to heal. So these are all the symptoms that will occur. This is an image of a diabetic foot, where we can see the microvascular and the nerve damages in the feet. We can see that these are the damaged artery walls and the blood cells have been damaged, and these white molecules which you can see are actually the excessive sugar molecules. So what happens when these sugar molecules increases? When these sugar molecules increases in the foot, what happens is that I just discussed with you all these points. These points occur. These are the symptoms which will occur if the blood sugar level increases in your foot. And there will be also damaged nerve fibers, that is neuropathy. Now let's move on to the next slide. In the next slide, we will understand what are the types of diabetic foot problems. Let's see. First is the neuropathic foot, where we will feel numbness in our foot, there will be ulcers, and there will be some deformities in our foot. Then is ischemic foot. Ischemic foot is like there will be poor circulation of blood, the skin will be pale in color, and the skin will be cold. So that is ischemic foot. Then is the neuroischemic foot, which means that it will combine both neuro and ischemic, where the both will be combined, and that will be the highest risk. Those patients will feel the highest risk who has both neuro as well as ischemic foot. Each type requires a different management approach, but all can be prevented with a proper care. If we take care of the foot properly, then it can be prevented. Like any foot problem can be prevented. Let's say it can be neuropathic, it can be ischemic, or it can be neuroischemic. All can be prevented if proper care is taken. Here we can see a picture where it is showing the three different clinical types of foot problem. This is the neuropathic foot, where we can see a painless ulcer. There will be a painless ulcer in the foot. The foot will be warm, and the foot color will be changed into pink. There will be strong pulses. There will be painless ulcers. The ulcers will not pain. There will be foot deformities, and of course there will be dry and cracked skin. In ischemic foot, what will happen? The color of the foot will change into pale colored. So you can see the color has been changed. There will be weak, absent pulses. There will be severe pain wherever where neuropathic pain foot there is no pain. Here in ischemic foot there will be pain, and it will be severe. Then painful, slow healing ulcers we will see. Then obviously we will see gangrene, that is the necrosis of the tissues. And last but not the least is the neuroischemic foot, where there will be similarly pale, cool foot, reduced pulses, moderate pain, ulcers with mixed features, high infection risks. So these are the three types of diabetic foot problems. Moving on into the next slide, we will see why the staging of the diabetic foot is so important. Why do we stage the diabetic foot? Staging helps the doctors to measure the severity of a diabetic foot ulcer. It predicts healing time, infection risk, and chances of amputation. That the doctors can understand that what is the stage and at what stage it needs to be amputated. The limb needs to be amputated. Doctors can understand by the staging. Guides the right treatment plan from the dressing to the surgery. Two main systems are basically used in this diabetic foot staging. That is, one is the Wagner classification and the second one is the University of Texas classification. We will be going into the detailed classification, each of the detailed classification in our upcoming slides. Now here is just an image to portray the severity of the diabetic foot. It can be mild, it can be moderate, it can be also severe. Now, coming into the Wagner classification, which is a very simple classification model, and this model is widely used. So what is it? Here I have attached a table for your understanding. Here we can see that it is divided into 5 grades, and there is a clinical description and a typical management. So starting with the grade 0, the clinical description, if the foot is in a grade 0 stage, then the clinical description the doctors can understand is by that there will be an intact skin, but there will be some kind of deformities or some kind of callus will be present, like it will be in the pre-ulcer stage. Then coming into the typical management, there will be preventive care, and of course there should be a proper footwear. Now coming into grade 0, there will be superficial ulcer, like the skin will only be affected. Typical management involves wound care, offloading and glucose control. In grade 2, there will be ulcers which will be extended to the tendons or joint capsules. There will be debridement, and if antibiotics, if infected, if the foot is infected, antibiotics are prescribed. In the grade 3, there will be deep abscesses or bone infection, that is osteomyelitis. We have to give them antibiotics, surgical damage, IV. In the 4th stage, there will be localized gangrene or forefoot or heel. There will be vascular surgery or partial amputation. And if it is in the 5th stage, then there will be extensive gangrene of the entire foot, and there will be major amputation is often required, like a portion of a limb will be cut off. Now coming into the University of Texas system, grade and stage. This system is divided into not only grade but also stage. So it combines the depth, like if it is talking about the depth, then it will be grade 0 to 3, and if it will be talk about the severity, then it will be stages A to D. Okay. Now grades, that is the depth. What we understand is that if it is 0, it will be pre or post ulcerative lesions, and if it is 1, there will be superficial ulcers. If it is 2, it will be into the tendons or capsules. If it is in the grade 3, it will affect the bones or joints of our legs. Now coming into the stages where we will understand about the complications. First, if we talk about stage A, it will be clean. That means there will be no infection or ischemia. If it is in the stage B, then it will be infected. If it will be in stage C, then it will be ischemic. That is poor blood flow. And if it is in stage D, then that will be infected plus ischemic. That is, it will be the most severe case. Now this is the grade and stage. Now here I have attached a figure where we can understand the Wagner ulcer classification. Now I just described to you guys that what is grade 0, what is grade 0, and what is grade 1, what is grade 2, what is grade 3, and what is grade 4, and of course what is grade 5. So here in grade 1, in grade 0, we can see that it is a pre-ulcerative area without any open lesions. Like we can see a clear foot. There is no kind of open lesions. It is looking like a normal foot, and there is no lesions or there is no ulcers being showing. So it is in grade 0 stage. If we come into the grade 1 stage, there will be a superficial layer where there will be a superficial ulcer that may penetrate to the dermal tissues, like it can penetrate to the epidermal layers of the skin. In grade 2, what happens is that there will be deep ulcers, like it will reach to the ligaments, tendons, joint capsules, or even the bones, but without abscesses or osteomyelitis. There will be no abscesses or osteomyelitis. In deep ulcers, we can see the color of the ulcer will change into black, where there will be complications and there will be presence of abscesses, osteomyelitis, or joint sepsis. In the 4th stage, as we can see that apart from the ulcer region, in the other regions also, there will be discoloration of the foot. Like there will be localized gangrene involving part of the toe or heel. Then comes the global foot gangrene, where there will be the complete discoloration of the foot and the whole entire foot will be discolored, and there will be ulcers in different areas of the foot. So you should pay more attention to the wound condition. if it worsens, it would be better to return to the doctor as soon as possible. So as your foot ulcers deteriorate, you should look into that and seek for some medical help. Coming into the University of Texas classification, what I just now told you about the grades and the stages, if it is in the grade, if it is in the stage A and grade 0, 1, 2 and 3. So let's understand what will happen if it is in the stage A and grade 0. Stage A, grade 0, we can see the foot is swollen, but it is clear in structure, and there is no ulcerations in the foot. So this is the pre or post ulcerative, that is completely epithelialized. Like it is, the skins are only affected, otherwise there is no other ulcerations. What will happen if it is stage A, grade 1? There will be superficial ulcer, like partial or full thickness, not involving tendons, capsules or bones. It will not involve bones. What will happen in stage A and grade 2? The tendons or capsule will be involved without palpable bone. The bones will not be affected. Now coming to grade 3 and stage A, there will be ulcer prone to bone. The bones will be completely affected and the ulcer can reach to the bones also. Now we will understand about the stage B and grade 0. This is with infection. In stage B, there will be infection, but there will be no ulceration. In grade 1 and stage B, the nails will be affected. There will be similarly infection. In grade 2 also, there will be severe infection. And in grade 3 also, there will be infection that will reach till the bone. In grade C, we can see there is ischemia, that is, there will be a poor blood flow in the leg region. The toes will be affected in grade 1. The fingers will be affected in grade 2, and the whole leg will be in a disorientated stage, and there will be complete ulceration, and there will be complete there will be no blood supply in the foot region, that is complete infection with ischemia. In grade 0, 1, 2, 3 for stage C. And the last one is the stage D, where grade 0 we can see both infection and ischemia. In grade 1 also there is both ischemia and infection. Similarly, in grade 2 we can see that the toes are half amputated, that is, it is not amputated actually, it is completely rotten with infection and ischemia both. And in grade 3 also there is part of the toe is affected by ulcers. So both infection and ischemia is causing this. So in different stages the foot will look different. So doctors can understand by this. Early warning signs, what we have to understand is that when we can feel these signs are happening, we can understand that it can be a case of diabetic foot. First symptom that's need to be mentioned is that numbness, tingling or burning in the feet. Here is the picture that I have attached. So in this picture you can see these are the early signs where we can understand about the diabetic foot, where there will be numbness, tingling or burning. There will be cracked and dry skin. There will be change in the skin color or temperature. There will be wounds which are not healing properly. There will be pus and there will be foul smell in the foot, and there will also be swelling in the foot. And many patients ignore these signs until it's too late to be going into grades 1, 2 or 3. What are the risk factors? Poor blood sugar control. Like here I have attached another picture where you can see the ulcer, and this ulcer can be caused by different factors. What are the factors that is listed in this image? Like aged people can be prone to these ulcers. Obese people can be prone to these ulcers. Hyperglycemia can be prone to this ulcer. Diabetic retinopathy, hypertension, smoking, all these are the causes or the risk factors. Long-standing diabetes, when you have a diabetes for a long period, smoking, obesity, kidney disease, improper footwear, the longer you have had diabetes, the higher will be your risks. Diagnosis and evaluation. Physical foot exam, that is checking the skins, nails and pulses. Monofilament test is a test which is done to test the sensation of the foot. If you don't have any sensation, that can lead to a diabetic foot. Then Doppler's test is the test which will measure the blood flow, what amount of blood is flowing to your foot. So that is a Doppler test. There can be X-rays and MRIs. Doctors will be prescribing you to do an X-ray of your foot and or an MRI, where you can check for infections, or if any bone is involved in your foot, if any of your foot, any of your bone of your limb is affected or not. So these are the physical examinations that the doctor will tell you to do to diagnose and evaluate the diabetic foot. And there will be regular foot screening, should be a part of your every diabetics checkup. If doctors if doctors think that it may be a case of diabetic foot, then there will be regular foot screening. Common complications which occur is that ulcers, like open wounds that don't heal. This is the most common complication that occurs in diabetic foot. Then there will be cellulitis. That is, cellulitis is skin infection. Then osteomyelitis, that is bone infections, bone will be affected. Then gangrene, that is the tissue death due to no blood flow in that area. And amputation in severe cases, and in neglected cases there can be amputations. Over 80% of amputation starts from a small untreated wound in the leg. What are the treatment options? Management involves blood sugar control. That is a cornerstone of the treatment. Wound care, cleaning, dressing, antibiotics. Then debridement, that is removing the dead tissues. Surgery in severe cases where the infections is severe, or if you see there is gangrene. And offloading, that is usually using special footwears, braces or even crutches to reduce the pressure in the leg. And healing will take time, but prevention takes just minutes per day. Prevention is the golden rule. Daily foot care tips. Here I have attached a picture where you can see the foot care for the people who are with diabetes. That is, inspect your foot every day, check for any cuts or color change, wash and dry gently, especially between the toes. Moisturize your feet but not between the toes. Trim the nails carefully. Never walk barefoot. Wear soft, well-fitted shoes. Control your blood sugar level. Stop smoking. Prevention is much cheaper, safer and far less painful than amputation. When to seek for a medical help? Call your doctor if any wound doesn't heal within 3 to 5 days. You noticed swelling, redness or foul smell in your foot. There is a sudden pain, black discoloration or fever. Don't wait. Early intervention saves limbs. Key takeaways. Diabetic foot equals to nerve plus vessel damage. Poor care leads to infection, and infection leads to amputation. Regular checkup is necessary, and early care can save lives. Remember, check your feet daily. It could save your leg. Coming to the conclusion, diabetes may be lifelong, but foot complications don't have to be. A few minutes of daily care can save years of pain and suffering. Share this video, you might just save someone's limbs or even their life. Don't forget to subscribe for more medical awareness videos. Thank you. Thank you.